had a lot of improvement in stroke prevention already several years ago. We still improve now, but I think the big step was probably 10 or 20 years ago. The big progress during the last years was in the treatment at the acute stage of cerebral ischemia, so the most frequent type of stroke, and especially in the domain of thrombectomy. This has really been the revolution in the management of ischemic stroke and even in the organization of stroke care, because now we have to detect large vessel occlusion as soon as possible after the onset of stroke, to be very quick, and to refer the patient in the center appropriate to perform a thrombectomy if needed. So this has been I think the most important progress we had. Another important progress we had was to forget the clock. It's not really true, of course, we are not forgetting completely the clock, but we have progressively replaced the timing by the status of the brain. So imagine as progressively, the decision to treat a patient depends more now on the imaging finding than on the delay. Before 25 years ago, for thrombolysis, we used only the delay. It was within 3 hours, within 4.5 hours or not, we treat or not. And now we forget a little bit this delay. Not completely, but we have the delay is less important now. And what is important now is the status of the brain. Is it likely that the patient has a penumbra? If yes, sometimes we can treat the patients, especially with thrombectomy, even if we are 8 or 12 hours after the onset. But this is not a good reason to wait, because irrespective of the type of treatment we give, the sooner after the onset, the best. Well, I think it was a big meeting. It was not just a stroke meeting, even if stroke is my field. It was a neurology meeting, which is always important because stroke is just one important, but one part of neurology.